How to tell drug-induced lupus from other conditions. Drug-induced lupus is a form of lupus that can occur as a reaction to certain medications. It shares many symptoms with systemic lupus erythematosus, the most common type of lupus. Understanding how to differentiate between drug-induced lupus and other conditions is essential for proper diagnosis and treatment. First, it is important to know that lupus is a complex autoimmune disease. Symptoms can vary widely and may mimic other conditions, making diagnosis challenging. There is no single test that confirms lupus. Instead, diagnosis relies on a combination of clinical evaluation and multiple laboratory tests. Common symptoms of lupus include fatigue, joint pain, skin rashes, and fever. These symptoms can fluctuate and overlap with other diseases, including rheumatoid arthritis and other autoimmune disorders. In drug-induced lupus, symptoms typically appear after starting a new medication. Common drugs associated with this condition include certain antihypertensives, antibiotics, and anti-seizure medications. To distinguish drug-induced lupus from other conditions, healthcare providers often start with a thorough medical history. They will ask about recent medication use and any new symptoms. Blood tests are also crucial. The anti-nuclear antibody test is commonly used. While nearly all people with lupus test positive for this antibody, a positive result alone does not confirm lupus. More specific antibody tests can help support the diagnosis. Complete blood counts can detect anemia or low white blood cells, which are common in lupus. Urinalysis may be performed to check for kidney involvement, which can occur in both drug-induced and systemic lupus. If kidney damage is suspected, a kidney biopsy may be necessary. One key difference with drug-induced lupus is that symptoms often resolve after stopping the offending medication. This is not always the case with systemic lupus, where symptoms can persist despite treatment. It is also important to note that drug-induced lupus typically does not involve the same level of organ damage seen in systemic lupus. For example, drug-induced lupus rarely affects the kidneys or central nervous system. Management of drug-induced lupus focuses on discontinuing the triggering medication and may involve treating symptoms with non-steroidal anti-inflammatory drugs. In contrast, systemic lupus management is more complex and may requiring immunosuppressive therapies. If you suspect you have lupus or are experiencing symptoms, it is crucial to consult a healthcare professional. They can provide personalized advice and determine the best course of action based on your specific situation. Remember, understanding lupus and its various forms is essential for effective management and improving quality of life.